who we are and the operation that we have and the system that we have, I could double my fee tomorrow and I still would make it work. And I could lower it and I'd still probably make it work. Everything else is working. It requires way more than that one little thing, the fee. You think the fee is the thing that changes the game for us? No.
Trolls do provide valuable insight. And if you can look at it and actually be critical about it, does this person have a valid point, even if you don't like their delivery? And then it's up to you whether or not is the point valid or is it not? And this person's truly just being a hater, right?
Welcome to the Dental and Mental Podcast. I'm Dr. Galen Detrik.
I'm Dr. Davina Detrik.
And we are going to be talking to you about the business and the mindset of dentistry.
Welcome.
Here I am. Hi, how are you?
I was saying welcome to the nest.
Oh, well.
Just kidding.
Who knows? Maybe there's nobody on the other end.
Hello? Hello? Just pulling an Adele here. Good to have you here, sweets.
Yeah, I'm happy to be here with you.
You look fantastic.
Same to you.
Why, thank you. Thank you.
Well, some new stuff has been happening at Vita.
It's true.
So
it's true.
I wanted to ask you a few questions about a day that you had was it last week?
It was a week and a half ago.
Okay.
Yeah.
So the biggest day that you've ever had in dentistry.
Yeah.
Biggest day.
Biggest day.
Highest producing day. You also had somebody join you for that day that was supposed to be shadowing.
Mm-hmm. Yep.
And I want to talk to you about that. But the whole day, obviously production is a huge piece of that day, just being really mind-blowing.
Yeah.
But then there are also other facets that I want to talk to you about. What's happening with the marketing at Vita? There are some new things happening there.
True.
You had
lots of things.
A special guest that day visiting you and Devin.
Yep.
I drove up with the two of you, so I want to talk about that. So first, let's get into the production side of the day. So
Devin and I were driving up. We usually start at 7:30. So 7:30 in the mornings when we begin. We usually get up there about 7:05 or so, do our team meeting. And we had a friend who was shadowing us because there's a potential, due to the growth that we're experiencing at Vita, of bringing this gentleman on. Okay. He said, all right, let's meet up in the morning. It was a great morning. We all got coffees and ready to rock and roll. We were talking on the way up.
Well, for context, how far is the drive
So
to Vita?
the drive is about 45 to 50 minutes every day.
Okay.
One way. So we're in the car for about 2 hours a
Yeah.
day. And we're driving up and we hit, this is the first time in 3.5 years this has ever happened, but the freeway going up to Santa Fe was completely stopped. And they actually shut it down for about an hour and a half. So we were just sitting there in the car. And I mean, we were telling, we're like, this isn't usual, just FYI. You know, you're trying to bring
Scaring
a person on
him
and be like,
off.
hey man, it's gonna be great. You should totally come up and work in Santa Fe. Every day is a 2-hour wait, you know? So it was definitely a different experience for him. Well, we're sitting there in traffic and Devin's being Devin. And he's like, so why do you want to quit your job? Like, why do you want to work with us? What's going on here, you know? And kind of put him on the spot. And he said something really interesting. I'll get to what we produced in the day, but this is kind of interesting. He said, well, my implant rep actually told me something at one point in time that really hurt. And we're like, well, what did he say? You know? And he's like, I wasn't even offended by it per se. He's like, it was so true that it stabbed me in the heart. And we said, okay, well, what did he say? He's like, we were talking about, you know, what I was being paid because he's an associate in this practice. It's a corporate practice. And so no ownership there. And he wants that. He said, the implant rep said, oh, so they pay you just enough to give up on your dreams. And he's like, oh, yeah, I think that's true, actually. Now, it didn't propel him to change right away. That was about a year ago, but it sowed a seed and he's been thinking about it ever since. So he's like, I want to see how you guys do things up at Vita. Long story short, by the time we got up there, we had to cancel our first like 5 or 6 patients because it took us, we were supposed to see them at 7:30. We did not get started until 10 a.m. So you just removed 2 providers, 6 patients. And despite that, we worked from 10 till 4. We went a little bit longer that day, worked through lunch. So about a 6-hour day. And jointly, we produced 96,000. And I think I produced 78.
That is so, for him driving up, that has to be mind blowing.
Yeah, it's 73. Sorry, 73. I had to think about that. 73.
You produced 73.
I produced 73. Yep. He was, I think he was over the moon. I think he was shocked.
So was he shadowing was he watching you and Devin, how you schedule? What was he doing for the day?
Yeah. So the goal was just to bring him up to say, hey, here's what we're doing. Here's what a day looks like. We told him, like, it's not necessarily a typical day. I'm not producing 75,000 every day, but it was the style of dentistry that I like to do. I just happened to be doing an upper and lower arch, and I think we started an ortho, a couple other things. So anyway, by the time it was all done, his goal, or our goal for him, was for him to be exposed to our team, our flow, the style of dentistry that we do, our type of patients, the pacing of things. Mm-hmm. Devin's a lot more of jumping from op to op, and he likes to be busy and likes to move a lot that way. I like to focus on, 5 to 6 patients a day, doing consults in big cases.
Right.
So it was a good exposure for him. The crazy part is, because he's licensed obviously in our state and all the rest, he was up there and we were like, dude, we have so much going on marketing wise, like you said, that's totally new and crazy and like popping off. Things that we're putting into the lab, by the way. We're sharing everything that we're doing with doctors specifically in the lab, which is our 12-month kind of course, just month after month, showing you exactly what we're doing in these different facets, from marketing to skill sets, everything.
To stop you for a minute, that was the whole purpose of the lab.
Correct.
Right? Is the lab is an acronym for living and breathing, meaning
Right.
what are we currently doing now, today, not 10 years ago? What are we currently doing today that is working? What are we tweaking? What are we iterating? Where are we at in the process? So you guys are going to be really talking about the marketing that you're implementing in Vita to be getting this wild influx of patients.
Yeah, the what's in dentistry can be very timeless, right? Like bonding protocols. You might shift and change things a little bit, but for the most part, what works. So certain skill sets are that way. They're timeless. The how changes all the time, right? The market and demographics and what resonates with people and how things are actually implemented change all the time. I mean, literally within weeks sometimes. That's a huge failure in dental CE just as a whole, right? The only exposure you'll ever get to that really is a very active consultant who also is a dentist and understands things, right? Like you need that, or you have to have a coach. Those are the only ways you're going to get that. Otherwise, it's content that was done before, or you go to a course and then that's it. There's a real finiteness to it.
Or even somebody understanding how to make content, which is a huge conversation that's missing, right? So even if you knew everything that you had to do to market, nobody is really having the conversation about how much content you have to produce to keep checking on the metrics in the data set and who is making that content. Is there a system for even making that amount of content to be able to get out when you're marketing, right?
Yeah, we're filming all the time, aren't we?
Yeah.
We have Dylan should probably just move in with us.
Right.
Right. It's an enormous amount of content for it to be real time. But everything is, like, to your point, it's living and breathing. It's in real time. These are the things that we're doing. And so I mention that because I think it is important. We've made plenty of mistakes, and we've had things that worked for a time and then kind of, the valve shut off. But right before this gentleman came up, we had kind of turned on a new faucet, and it was around marketing for a specific type of patient in a very specific way. And when we did that, I don't think I've ever seen something work so fast and so immense. Mm-hmm. And so we're slammed with patients. Slammed. Bleeding.
Well, you don't think that something, because we all know that usually things don't work that quickly.
No.
So you guys probably weren't prepared for what you got.
No.
Like in the schedule, or
it's almost like when COVID lifted,
right?
And all these practices were like, "Oh my gosh, the phones will not stop ringing." It was kind of that experience all over again, which is wild because we have a lot of, obviously we work with a lot of dentists. We got a lot of friends that are dentists. Too many friends, probably, they're dentists, And we had just got a call probably a week prior by a doc who's great doc, very successful. And he's like, are you guys experiencing a slowdown? Like things are just so quiet here. And he was saying that a lot of his friends are the same way. And we're like, not to make you feel bad, but no, it's the exact opposite. Like we cannot keep up with all this. All that to say, the doc we brought up, we were like, do you want to see patients with us? Like bring your loops. Okay. And he did $10,000 that day.
Wow.
You know, so coming from a corporate practice and
And
an absolute mill.
how many patients did he see to produce 10K?
Well, by contrast, usually he's seeing about 30 to 40 patients in a day.
Okay.
Okay. And he'll produce around that 10 to 12,000 in a day. But he's killing himself.
Right.
He saw 3 patients at our practice, right? So 3 patients, and that's what he produced in that. And I think he just had a blast. And once we finished up and we were driving home, we asked him like, how was the day? And he's like, he was lit, you know, and he's like, forget the drive, like no problems there. Because like, it was just so nice to be able to actually have conversations with patients. It's like they were so happy to do this. You know, meeting these patients for the first time, and they're like, and I would introduce them, and Devin would introduce them, and they're like, well, if they trust you, like, of course, like I'm definitely down, you know? And so we had patients who were loyal and were like, absolutely, by all means. And he's a great dentist, but a different experience, you know? And I think it's an important lesson that you really do not have to work your tail off in order to kind of produce those things. In the end, developing the system does take a lot of time. Developing that system and that operational capacity is a lot of work.
So the other thing that I want you to touch on is I was having a conversation with a client the other day, and we were talking about, it was a blip in his schedule where the schedule got kind of mixed up, and it was a slow day.
Yeah.
And then it was a second slow day, and it was kind of some miscommunication with the team. And he said, not that money is the goal. The money is never the goal. But if I'm not serving the people that I'm meant to be serving, I do feel some kind of way about that.
Yeah.
Right? So I want you to talk a little bit about that. It's like money isn't the goal, but it is a metric of, are you serving the people that you're meant to be serving with a certain skill set that you have? Can you talk a little bit about that? Because I wonder what that feels like, where it's like, okay, well, I'm helping 40 people and producing 10K, or I'm helping 3. Do you see a discrepancy there by feeling like you're not doing enough, or, right? Like,
yeah.
How does that feel? Did he say anything about that on the ride home?
I think, I mean, to encapsulate it quickly, him saying how much fun it was. Fun, that was the word he used. It was fun making that money because he felt like he was doing the kind of dentistry that people actually wanted. Well, how do you know that that's what they want? You had to have those conversations. I have a patient, and her name's Robin, and Robin is a sweetheart. But Robin is comes from a lot of money. Money is not a problem at all, and so we did a bunch of dentistry for her, and she just doesn't care for it, and we tell her each and every time. You know, I bring that up because that money doesn't feel good to me. Like there's a part of it sometimes where I think if you're just going through the motions of like making things happen, money for money's sake is not that great, because the depth of the change that happens in a person is what I think actually makes us feel good about what we do.
Yeah.
You got somebody else who you do something very small for. It could be an extraction of a tooth where it was killing them, you know, or it could be a little composite bonding, and that minor expenditure, that money feels way better, right? When you get that, you're like, it went to something that was productive, that had momentum. And I think it's that age-old motion versus momentum going somewhere. So I think he felt that. It was like, he can go make that same amount of money. He's just going to be doing a lot of motion that day and feeling like just ticking off boxes. Doesn't have that depth versus momentum. If he had produced $3,000 to $4,000, but had that same interaction with patients, he probably would have felt like, I saw 3 patients, I had this amount. It was a good day. Good things happened. your client, if you have a couple of days like that, you're not living up to your potential.
That's it.
And that sort of drives you crazy, right?
Right. That's it. It's not about the money, but it's the metric by which we have to say, well, to what capacity am I serving? And obviously you have fee schedules associated with that. So not to get down on a tangent, but your fee schedule is your fee schedule, right? So you can't compare that fee schedule to a fee schedule in public health. We're talking apples and oranges. But completely. You know what it is for your practice and what that dollar amount signifies in your practice and who you're helping in your practice.
Yeah, I mean, people always say that. They're like, oh my gosh, well, you produce that. We have a lot. We have, Devin has plenty of haters on Dental Town, far more fans.
Yeah, okay, yeah, there we go.
But the detractors, the haters, they always cite our fees. And they're like, oh, I could never charge that. When you really look at our fees in light of America and what people charge, we're high middle, maybe. We're definitely not high. I have plenty of coaching clients with you who charge more than we do. Yeah. Way more.
Right.
And so I don't think it's that. I honestly think that it's, Dev and I were talking about this the other day when we were doing Credo for the lab. And we're saying you can take information from somebody, a marketing course, and something that's just incredible. Man, that is fire. But if you try to slap that onto a system and skill sets and belief systems that aren't in harmony with that new found idea, it's not going to get you the same results. So when people cite your fees, it's like, I can put my fees way up here. I can put them way down here. It actually doesn't matter. It's completely irrelevant. Who we are and the operation that we have and the system that we have, I could double my fee tomorrow and I still would make it work. And I could lower it and I'd still probably make it work. It's just everything else is working. Does that make sense? Like, it requires way more than that one little thing, the fee. You think the fee is the thing that changes the game for us? No, get your head out of your ass. That's not right. That's the stupidest thing I've ever heard of.
Right. I think that is really true. And you and I have experienced this early on in Thrive when we tried marketing and it wasn't congruent with who we were. It was such a dumpster fire.
Yeah, give a little context to that story because that's actually interesting.
So we were in a place in our business where everything was going really well. It was right. We were brand new, like hot off the...
A lot better than we thought it was going to go.
Yeah, a lot better than we thought it was going to go. Brand new. Everything was novel and fun. Our courses were doing great. People were really excited about it. And we were working with a lot of mentors at the time. And one piece of advice that we got was, the fire is burning hot. Throw gasoline on it. You need to hire a marketing company and really take this over the finish line.
Right. Yeah.
So we did. And we hired literally the best internet marketing company
in the world.
Yeah. Absolutely fantastic.
We were feeling really good. We're like, man, can't keep us down.
Oh, yeah.
We're crushing.
Right. If the advice is get the marketing team and throw gasoline on your fire, then that's what we're going to do.
Striking while the iron's hot. We did. Yeah. It was the best in the world.
Right. So we took that playbook and we were supposed to make content that was working in marketing at the time. So this was like, 8 years ago?
It was the template, right? This is the template of what works.
Yes, and this was 8 years ago. So things have changed now. But at that time, we were making content based on what was working. And it was really not in alignment with us. And by what I mean, it was so... like sleazy. It felt like sleazy. It was like, this is not what it was, but it might as well have been like, act now, buy today, live the life of your dreams. Like, it was very like, Price is Right.
It was like late 2017, right?
Yes, it was like a very Price is Right vibe. Like, let me show you how you can do it too. It was very much that. And you and I were brand new at the time. And so we hired the best marketing company. Who are we to disagree with what you would have us make? So we go and make that kind of content. Not that we felt great about it, but we're also very good students, right? Like, we want to be top performers. We want to do what we're asked. We want to do it to the best of our ability. So we go and make that content. And as it should have, we got a lot of comments like, who do you think you are? This is the douchebags, like all of that. And you know what? Those trolls, they were not wrong.
God bless them. They were actually speaking the truth.
Those trolls were not wrong. I'm not even mad at them to this day. Whoever had the nerve to call us douchebags, like, I hope you're well.
I mean, we should go back in the comments and go send them a gift.
Yeah, right. God bless you, trolls. So yeah, the trolls were not wrong.
No.
And we felt it too. So
Which is an interesting point.
We felt
I
it
think,
too.
Don't you feel like today it's like, oh, you know, you have to avoid all hate and anyone who detracts from you, take it away. And it's like you insulate yourself to such a degree that you can't hear truth.
Right.
That doesn't mean that everything that people say is right. And it doesn't mean that, you know, there's certain levels of quote unquote toxicity that you don't need to expose yourself to. And there's truth in a lot of these things and you're going to miss some gems.
Oh my gosh.
You know.
This is, who knows? I don't know what our audience can think of this story, but it's so funny. Okay, so there's this influencer I really like.
You can't care, you know?
There's this influencer I really like, and I think she's really funny. She told the funniest story the other day, and I was like, wow, this story is so many layers deep and so self-aware. So she was talking about how she and another person were going for the same parking spot at the grocery store, okay? And the other person snagged it from her, even though she had like her blinker on or whatever. So she gets out and she starts like saying some stuff to this person. And in the moment, she's like, so she just had a baby and she was like doing a mental inventory of whether she had bounced back. Okay. She didn't know. She was like, I think I've bounced back, but maybe I'm fat and I don't know.
Okay.
So she's talking about going at this person for stealing her parking spot with a pure intention to see if they'll call her fat. She's like, because if you get in an argument with somebody, if they call you fat, you know you are.
Like
but
the
if
truth comes out.
Yes, if they don't call you fat, she's like, then I'll know I'm like on the right track. So she...
This is the craziest experiment of all time.
Yes, but how self-aware is that?
That's pretty good.
This isn't, to me, when I was listening to her tell the story, I was like, this isn't even crazy. This is the sign of a genius.
Right.
It's not even an argument for argument's sake. It's market research.
What is that, like emotional actions or sober thoughts or something like that? Yeah, it's like that's,
I don't know, but I think that's where we're going with this story.
Yeah, I got you.
So anyways, they had some exchange of words and she didn't leave flustered. She was like, wow, that went really well. He didn't even call me fat. And it was just like, I am on the right track. And I thought, what a great way to use that interaction as a good test of, self-awareness.
I think the audience is going to very much appreciate that.
Look, I like what I like. And I liked that story.
And I like you and I like that too.
It felt relevant here. But right, so and to your point, I loved what you said. Sometimes trolls are not bad. Trolls serve a purpose. Mm-hmm. And if you take what they're saying and you use it for self-reflection, but all of that to say, trolls do provide valuable insight. And if you can look at it and actually be critical about it, does this person have a valid point, even if you don't like their delivery? And then it's up to you whether or not, you can assess, is the point valid or is it not? And this person's truly just being a hater, right?
If you enjoyed this episode of the Dental and Mental Podcast and this topic resonated with you, we go so much deeper inside the Thrive Lab.
So if you too want to be copied but not replicated, come join us in the lab.
And just for you, because you listen to the podcast, if you want a full $1,200 off of the year-long subscription, just use coupon code podcast. See you then. So this is interesting because Dev and I were talking about this yesterday when we were recording Credo for the lab. And this is something that came up that truly, if you can hear this, if you're listening to this podcast, watching this podcast, and you can hear this truth, it's a bit of a game changer. It really is. So the context is we were talking about objections that come up when you're presenting case presentation, treatment presentation, and how we oftentimes offload that obviously to a financial coordinator, whatever. What we realized is that objections, what people never really ask, they always ask, how do I overcome, I don't have enough money for this. Mm-hmm. They ask if they say I need to speak to my spouse, or I need more time, or I'm on a fixed income, how could you possibly, or if only I was 10 years younger, right? There's 1,000 of these. And people want to know, how do you overcome these objections? And they want that, what they're wanting is a sentence. They want a
What's the
smart verbiage.
What's the
wow,
verbiage?
what a good comeback.
Yes,
I just made him think, whatever. And I get that. I'm that way. Like you want, like, give me the answer. I want to fix it. So I don't judge it. But we need to step back a second and ask, why is there an objection in the first place? That question's important because when you think about yourself and how you buy things, when it's something that you want, you don't have objections. You overcome them yourself.
Mm-hmm.
You do. You use objections because something is making you feel like you got to get out of there. That's an objection, right? If you can't overcome it yourself, you're going to throw it out there in an attempt to buy yourself time or to get out from underneath this. It feels like pressure and you don't want it.
Absolutely.
Right? So let me go talk to my spouse. That means I got to get the hell out of here.
Mm-hmm.
Right? I can't afford that. Is give me time to think about if I can, but I don't want to be here right now. That's what that is. Can you hear that? And then a layer deeper. And this was, we went heavy into not just what this is, but also how you fix this. If you look at the way Devin and I have case acceptance now versus either one of us 6-7 years ago, we have way less objections, way less. To the degree where I think it's almost sometimes kind of hard to remember, like, well, how do we respond to those? Because we don't get them.
Mm-hmm.
Why is that? It's because we've stacked so much of our system into our advantage, right? When a person comes in, the entire flow to the place where they're going to hear what it is that they need is all so good, check mark, that there's nothing to object to. And we're not making you feel like you have to do it and all the rest, right? You have to take the 99% and realize that's actually what matters more than how you respond to the 1% objection.
Right.
Does that make sense?
100%.
And so that's a really hard truth to realize, that if you're getting a lot of objections, sorry, you're probably doing a lot of things wrong.
Yeah,
you're probably dropping so many balls as a team and as an individual, and that's not judgment. It's just face the truth.
It's
There's
opportunity.
Too many problems.
It's opportunity. It's opportunity to look at the system and to say, how can we actually streamline this so that you don't have that when you get to that point?
Correct.
From a consumer standpoint, I'm the easiest person in the world to sell to because I've already bought it. I just need somebody to pay.
Just give me one of those things. Give me a console.
Well, I've usually already done my research on whatever the thing is that I want.
Yeah.
Right? Like when you and I went to LA, and you were getting your tattoo, I went and got a haircut. It was a very expensive haircut. Nobody had to convince me.
Right. Right.
Nobody
when
was,
you know what you want.
Yeah, nobody was trying to be like, well, our haircuts cost X because they have this. There's none of that.
Well, okay, so to that point, you knew what you wanted, and you did research. What I'll hear back from dentists is, well, most of my patients are like, no one's ever told me this before. I didn't know I had these problems. I've been going to Dr. So-and-so, and they never said anything about this. That's where a lot of these objections come from, right? And I'm thinking, that's great opportunity. You should be making content. You should be talking to your patients. You should be using email lists. You should be doing all these different things to pre-educate them so that they are aware of what they could buy. Because make no mistake, you're buying things for yourself.
Mm-hmm.
It's no different than a watch. It's no different than a pair of shoes. It's a utilitarian thing. It's a good-looking thing. It's a whatever. We don't think of that way. That's the mistake. And we had done that podcast about programmatic thinking. That's what's going on.
Right.
It's just a program that's spitting out the way you're supposed to be.
It'd actually be weird to go to a
that.
car dealership and, be upset that somebody was trying to sell you a car. Like, what am I doing?
What if one of these tires falls off? What do I do then? You're like, I mean, what's the guarantee? Can you promise me I'll never get in an accident? No, I can't do that.
Right.
We don't take this approach to anything else. Devin used the example of, if you go to a dealership and you're like, hey, I have a job that is 50 miles away and I need a car. And they're like, okay, and how about this one? And you're like, I can't afford a car. Their job isn't to sell you a bicycle. Right? It is the understanding that you need that thing, so you're going to get that thing. Right? Why? Because that will help you do with all these other areas of your life. We just don't take that same approach and mentality towards dentistry And I think it's actually the way we perceive dentistry is the reason why it's so difficult for our patients to perceive it correctly.
Right.
Your perception is wrong.
Right. When you're apologetic about the thing that you're selling, then right. When you're apologetic, like, oh my gosh, I'm so sorry that you have to do this. I'm so sorry it costs X amount. I'm so sorry I have to, give you this painful shot. Like, when you're apologizing for everything, don't act like you're giving somebody a gift. No wonder.
We did like 4 or 5 extractions on somebody the other day, and they were calling the office and they're like, is it supposed to hurt? Is it supposed to be sore? And you're like, you had a surgery,
I was sore from an ear piercing one time for a really long time. Well, remember I told you that?
I remember
I was like
that.
talking about this ear piercing forever, and I was like, man, this thing is really sore.
Like, it's still really hurting me. Yeah.
Right, yeah. I was like still really sore because of the location. And I'm like, and people get face surgery and they're like, I don't know, am I supposed to feel anything? Well, Jim, my ear piercing still hurts. So having, 20 extractions, I'm sure.
It's biology and everyone's different. But of course, you had a surgery. It is natural to have it hurt. It is.
But it's that vibe, isn't it?
We tried to make it like, you'll never feel any pain. It's getting painless dentistry. Shut up.
And and it's like, right. But to your point too, even when you want something, it's like, yeah, I understand that there's pain associated with it. And when it's something you really want, you're not even sad about the pain. For example, was your tattoo painful?
It wasn't pleasant.
Okay. Were you okay with the pain? Is that something that you had agreed to, knowing that you would have the end result of a beautiful piece of art on your arm?
Yes.
Right. Did you then call June and be like, hey man, my arm's really sore. Like, what are you going to do about this?
I just wanted to talk to you, June. How you doing?
Right?
Yeah.
So I do.
Actually, to that point, which is interesting, you don't get June's phone number. You don't get his phone number. You don't get his email. You don't get any of those things. You work through his team. And I think that's something that we've done where I don't want all my patients having my phone number.
Right. We
because
insulate.
you have to.
Yeah.
And it's a smart thing too. Don't be your patient's best friend. That's actually a really, really dangerous place to be. You need to be an authority figure. You need to be somebody who they respect at all times. And they can deal with their own problem. Yes, things can go south. They can go wrong.
And you will have your team in place.
Have a team in place to do that. But I'm also not there for the person who's a chronic pain patient or someone who's been on medications for forever, who feels things at a much higher level. And, they had a filling done and they just lose their mind over this little postoperative sensitivity that doesn't happen on 99% of the other patients. That's not something I'm going to lose sleep over.
Right. I mean, to that point, so it's not just you, right? I had an elective surgery. My surgeon did not give me his personal cell phone in case I felt any kind of way.
No.
Right? You get the office email. We will follow up with you. Period. End of story.
Yeah.
I had no problem with that.
Right.
Because I'm assuming that there are post-op complications. We understand that. But you're also assuming that there is going to be a certain degree of pain and discomfort that is coming with having a surgery, right?
Right.
So,
well, a lot of this podcast has been expectations when you really think about it. Like even the doc that we brought in, like what was his expectation for dentistry? Well, he's being paid right now just enough to kind of remove or taint or change the way his expectations are. Right? What are dreams? Dreams are really expectations, things that you were hoping for and wanting. And if you're able to silence or mute those because you're pacified just enough, that's an interesting thing. Like expectations is it's a broad topic, but that's what we've been talking about really, is how to manage patients' expectations, how to manage your own expectations, and how to keep those things going. Like consistently push the boundaries of what you believe is possible and make it your own.
Right. Yeah. Absolutely.
So good podcast. I think the people might disagree. We don't know.
We'll find out. I mean, we welcome trolls. So if you hated this episode, please tell us in the comments.
Yeah. Just be truthful. Yeah. Awesome. We'll see you guys in the next one.
Bye.
Thank you for listening and or watching the Dental and Mental podcast. If you enjoyed this episode or any others for that matter, feel free to tap that subscribe button on YouTube, Apple, Amazon, as well as Spotify. While you're there, why not leave us a review up to 5 stars? And if you're on YouTube, go go ahead and leave us a comment. Let us know what topic you want us to discuss next.
If you like what you heard today and you want to be involved in the Thrive world, from coaching to courses or just to connect with us, go to thethrivedentist.com.